Good morning, everybody. Hello, I am V, the Florida coordinator for the East Coast Greenway Alliance, and thank you for joining us today. I'm very excited to welcome you to our first ever Southeast Greenway and Trails virtual summit. Before we begin, I'd just like to say a quick thank you to our summit sponsors. There was a lot of work that went into the summit, and we wouldn't have been able to do it without them. With that, I'd like to introduce one of our great Florida partners for this session, the Healthy Communities session, the intersection of public health and the environment. Susan will be presenting as President and CEO of the Health Planning Council of Northeast Florida. So I'm going to go and hand over the controls to them now. Just bear with me 1 second while I do that. All right, Susan?
Okay, well, good morning. This is Susan Grich, President and CEO of the Health Planning Council. I'd like to say thank you for allowing the Health Planning Council to speak at this year's summit and giving us the opportunity to talk about the Health Planning Council of Northeast Florida and its alignment with the East Coast Greenway initiative. Just a little bit about myself, very brief. I have been living in Jacksonville since 1974. My background is in the nonprofit and business finance background. And I, as well as our organization, are dedicated to the communities in our Northeast Florida region. We are actually responsible for Baker Clay, Duval, Flagler, Nassau, St. Johns, and Volusia counties. We as a population health data organization, as you know and can imagine, in the midst of this pandemic, have a couple of comments about this since we are health data. We are, as an organization, embracing social distancing. I'm bringing this presentation to you from my home office. We really encourage anyone who has the capability to work from home. And certainly if you're ill, isolation for 14 days. Our organization is up and running 100% remotely. We are really interacting with each other a lot, utilizing video teleconferencing, such as this. We're using Skype for business instant messaging. We are using Microsoft Teams for document collaboration. And so we just hope that you all are practicing these good behaviors as well. Albeit I'm not a spokesperson for the health department, I'd like to encourage you to get your information from the Florida Department of Health or other state Department of Health websites, specifically floridahealth.gov has great information and the most up-to-date information for our region. And of course, the Centers for Disease Control and Prevention, cdc.gov, has information for us as a nation. So with that being said, I'd like to go ahead with the presentation so I can provide you a little bit of data on the health of our region as well as how it relates to the East Coast Greenway Alliance. Okay. The name of our presentation is Healthy Communities, the Intersection of Public Health and the Environment. Public health and the environment intersect, and there are many, many opportunities to improve public health through our environment. First of all, who are we? The Health Planning Council of Northeast Florida, you'll see in the upper right-hand corner. We are one of 11 local health councils in the state of Florida. We have 7 counties, as you see. The other 10 health planning councils comprise all the health planning councils, and we are responsible in some part to population health in the whole 63 county region of Florida. We are authorized and guided in Florida state statute. We are also an independent 501c3 nonprofit corporation. We have a 12-person board of directors that is appointed by city and county commissions, and it's based on the population in each county so that we have adequate representation for our organization. Our reporting accountability is to the Florida Agency for Healthcare Administration, AHCA. And we adapt to the local regional needs and expand programs and funding as appropriate through grants, contracts, and fee for service. All right, what you'll see on this screen is actually our mission to improve health outcomes by serving as the source for health information, analysis, and planning in Northeast Florida. Our vision is to become, for Northeast Florida, to become the healthiest region in the state, and to do that through evidence-based assessment, data, and planning. Let's talk about this slide, community health and wellness. Your zip code contributes more to your health than your genetic code. That is evidence-based. Most people don't realize that. But where you work, live, and play has a huge effect on your health. This is through your methods of transportation, recreation, and or the ability to incorporate physical fitness in a safe environment. Those are health factors that can influence your length and quality of life. So I'd like to bring your attention to the graphic on the left. This shows all the factors that influence our life on a daily basis and have an enormous impact on our health and being overall. The East Coast Greenway is a fine example of the type of initiative that is paramount to improving public health. So if we want to take a look at the slide, starting with the figure on the left, number one, access to recreation and open space. Access to healthy foods, number two. Number three, access to medical services. Number four, access to public transit and active transportation. Number five, access to quality, affordable housing. Number six, access to economic opportunity. Number seven, completeness of neighborhoods. Number eight, safe neighborhoods and public spaces. 9, environmental quality. And 10, green and sustainable development and practices. Again, these are the factors that influence our life on a daily basis, and they do have a great impact on our health and well-being overall. So let's take a look right now at the data of our region to support this initiative. This is a slide from Gallup through their HealthWays program. They conduct 500 telephone interviews a day with Americans to gather their perceptions about their health. This results in a sample that represents an estimated 95% of all households. And what they do with those samples is formulate the responses into a well-being index, which you see on the screen, that produces both state rankings as well as ranking of the nation's 189 metropolitan statistical age areas, MSAs. Gallup and HealthWays started tracking state-level well-being in 2008. The index score for the nation and for each state is an average of 6 sub-indexes, and these sub-indexes individually examine life evaluation, emotional health, work environment, physical health, healthy behaviors, as well as access to basic necessities. Now, as you can see in relation to the color scale shown on the bottom of the map, Florida ranks in the second quintile in the states in overall well-being. You can see that the central northern states of the U.S. score in the top quintile. A cluster of states, Oklahoma, Arkansas, Louisiana, Mississippi, and a cluster of states in the north, Indiana, Ohio, Kentucky, Western Virginia, they score in the lowest 5th quintile. The table on the right shows the rank as well as the scores of Florida from 2014 through 2017. If you look at Florida in 2014, we ranked 26th compared to all other states in the United States for the general well-being of the population. And the following year, 2015, we climbed up to rank number 12. And that's where it's remained for the past 3 years, or the last 3 years. The well-being index score is an average between 1 and 100. The categories on the right provide more details and ranks comparing to all U.S. states. So if you look on the right, you see the purpose rank. That stands for liking what you do each day and being motivated to achieve your goals. The social rank refers to having supportive relationships and love in your life. The financial rank manages your economic life to reduce stress and increase security. The community rank is liking where you live, feeling safe there, and having pride in your community. The physical rank is having good health and enough energy to get things done daily. In 2017, Florida ranked best among all states in the social category, which I find very interesting. Okay, this is a very interesting slide, and I want to spend a little bit of time on it. This is from the County Health Rankings and Roadmaps program. That is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. This program is designed to improve health outcomes for all, as well as to close the health gaps between those with the most and least opportunities for good health. This work is rooted in a deep belief in health equity. Health equity is the idea that everyone has a fair and just opportunity to be as healthy as possible, regardless of race, ethnicity, gender, income, location, or any other factor. There are many factors that influence health, everything from smoking to obesity rates to unemployment to air pollution to education. All of those are considered health factors. So if you look on the screen, light blue to the right of the graphic are individual factors. They're combined into categories of health behaviors, which account for 30%, clinical care, access to care, quality of care, 20%, social and economic factors, 40%, and the physical environment, 10%. So let's look a little bit further. All right, so let's talk about the East Coast Greenway, and let's look at the health behaviors. The East Coast Greenway clearly can provide an opportunity for better exercise and better health behaviors. Let's go down to, well, with the clinical care. Someone who has transportation barriers may not have access to quality care. So that may help them improve in that area. And then, of course, we have the social and economic factors of 40%. Again, let's talk about the East Coast Greenway and let's talk about our communities. These areas allow for families and groups to come together and provide active transportation in a safe environment. You all probably have seen right now, a lot of people are out together, socially distancing, but families are riding their bikes individually, walking children and walking their dogs. So that's a big important part of social and economic factors. And then the physical environment, this is really, where the East Coast Greenway really is beneficial. It's in, fresh air outside, and it really helps with access and transportation in a healthy environment. So if you look here, those are all health factors. So all the way to the right is the light blue, and then there's a little darker gray, and those drive into the health factors. And the health factors drive the health outcomes. And you can see health outcomes are measured in length of life and quality of life. Now let's take a look at the county health rankings. Specifically, this is for the 7 counties in the Health Planning Council's region. There's a big difference. You can see there's health outcomes and health factors. St. Johns County, look in the health outcomes, #1. And then look at Baker, 50 out of 67 counties. And Duval, 44. And then if we look at the health factors, again, St. Johns County, #1. Baker, 39. Duval, 32. Again, these are the county health rankings for the state of Florida out of 67 counties. So we have a lot of work to do to improve these rankings. Now let's look in a little more detail. Okay, this shows in more detail how each of the counties rank for each of the health factors. The green circle indicates the category in which each county scored best, and the red circle indicated the category in which each county scored worst. Both Baker and Clay rank better among socioeconomic factors and worse among health behaviors. Duval County ranks better among clinical care and worse among health behaviors. Flagler County ranks better among health behaviors and worse among socioeconomic factors. And both Nassau and St. Johns County rank best among socioeconomic factors, but worse among physical environment factors. And finally, Volusia County ranks better among clinical care, however, ranks worse among physical environment factors. So you can see that with the actual health factors, they're all over the board, but you can see and draw some conclusions based on the red areas and the green areas where we're doing a pretty good job, and the red areas are where we have lots of work to do to improve our health factors, which ultimately drive our health outcomes, quality of life and length of life. So the question probably is now, how do we do that? Well, the Health Planning Council, our expertise is in evidence-based assessment work, which translates into planning, which translates into, well, a planning would be a work plan and an action plan, strategic planning, if you will, and then sustainability with that. We're demonstrating just one of our many assessment tools that we utilize. That's called a PACE-EH. PACE stands for Protocol for Assessing Community Excellence, and then EH is in environmental health. Basically, this guides local public health officials and communities through a process, and they explore physical and social environments that impact health and safety. And the assessment process actually engages the communities in a series of tasks to investigate the relationships among things like what do they value, how their local impact or environment impacts their health, and what actions are necessary to live safer and healthier lives. This methodology was developed by NACCHO, endorsed by the CDC, and has been used by many health departments around the country over the last 20 years. We have utilized this tool for the Clay, Department of Health in Clay, and we are actually currently using it for environmental assessments in Clay and Nassau counties. So this is an area where we have expertise. And the outcome is to prioritize local actions, programs, and policies to actually affect change. That's the goal. So now I've given everybody an understanding of our region. Let's go ahead and dive into some data that's more specific to a self-multi-use path, such as the East Coast Greenway. Okay, this is some information by Dangerous by Design. It is a program from Smart Growth America, and it lists the PDI, or the Pedestrian Danger Index, for each of the 100 largest metro areas in the country. You'll probably notice there, those are all, well, most of them are in Florida. Florida remains the most deadly state for pedestrians and cyclists. and 8 of Florida's metro areas make the top 10 list of the most dangerous metro areas in the U.S. The most dangerous cities located in Florida and within our region at the Health Planning Council of Northeast Florida are Jacksonville, Deltona, Daytona Beach, and Ormond Beach. From 2008 to 2007, Jacksonville was number 6, which means over that period of time, there were 419 pedestrian deaths in Jacksonville. If you do the math, that means someone died almost every week. All right, let's talk about pedestrian crashes and fatalities. This is from the Florida Highway Safety and Motor Vehicles. I would like to go ahead and caution you that the data from 2019 is preliminary, and the data from 2020 is so preliminary because we actually are already in 2020. So I would caution you to pretty much ignore the 2020. That won't be valuable until we have a full year's worth of data. As you can see, pedestrian crashes have increased from 2018 to 2019, and 2020 continues to be on target to exceed 2019. If you consider the number of months that we've completed in 2020. If you look at the pedestrian fatalities, in 2018 we had a total of 720 pedestrian deaths, and that is 60 per month at an average of 2 per day, people per day who lost their life on a simple walk. And recall from our prior slide that 2 of our counties, Duval and Volusia, were named in the top 10 most dangerous metro cities for pedestrians. Duval data count shows an increase in crashes as well as fatalities, where Volusia County shows a very slight decrease. Let's look further at the bicycle data on our next slide. So we just looked at pedestrian fatalities. Let's look at bicycles. Okay, so starting with the Florida data, on the bottom right-hand side, Florida sees an increase in the number of bicycle crashes from 2018 to 2019. And already in 2 months of 2020, which is what we had the data for, there have been 1,253 bicycle-related crashes. Many bicycle accident professionals believe this number is much higher, since the data is only reported if the sheriff, police, or Florida Highway Patrol are involved. Looking at the bicycle fatalities, we see a decrease at the state level, although in the last 2 months, we've already seen 22 people lose their life. If you look at the larger table, you can see data for our local region from 2018. Again, noting similar to the pedestrian data, Duval and Volusia counties remain our highest injury and death totals. Duval County stays very consistent from 2018 from 2019. But again, 2020 is already on target to increase with 4 deaths in 2 months. Just last week, another cyclist lost his life on Beach Boulevard here in Duval County. And then with Volusia County, there's been a slight decrease, as you can see, which is very nice to see. Although we don't speculate, one could suggest the low number of crashes and fatalities could be due to improved infrastructure to support the community with use of multi-use paths, lower numbers of residents, and lower use of bicycles in those counties, as we will explore in a few slides on commuting characteristics. And now let's take a look at this. I'm sure we can all agree that we feel better after a short walk or bike around the block, especially in a time like the present. Most if not all of us, are working from home. We're not attending sporting events, places of worship, art, dance, or music productions. We're not chit-chatting at the office copier. And so what do we have as an outlet for our stress? The outside. There is even a hashtag for our social media fans. Hashtag outside is free. In Duval County in 2019, there were 143 total traffic deaths. 56 of those deaths were pedestrian or bicycle. That's 39% of all deaths, which are bicyclists or pedestrian walking or biking to exercise, relieve stress, or get to a job to support your family. Duval County pedestrian bicycle crashes have not diminished significantly over 4 years. Pedestrian fatalities have improved somewhat for 1 year. However, cycling fatalities have more than the same year. Let's talk about our population and living within 500 feet of a busy roadway. Here you can see the percentage of population who are living within 500 feet of a busy roadway. In Northeast Florida, Duval County has the highest percentage at just over 13%. Baker and Nassau have the lowest percentages, as you can see. And on the right, you can see the state of Florida with the 67 counties. The darker the color, the higher is the percentage of the county's population living within 500 feet of a busy roadway. So that was the population living within the roadway. Now take a look at this slide. Look at the percentage of schools and daycare facilities within 500 feet of a busy roadway. You see Volusia County, over 22%, Clay County, over 22%, and Duval County, just over 20%, with St. John's, Nassau, Flagler, and Baker falling below. Here are some commuting characteristics for our 7-county area. Commuting characteristics are specifically the percentage of individuals by county who drive to work by car, truck, or van, public transportation, walking, riding their bike, taking a taxi, motorcycle, or any other means of transportation, and worked at home. Obviously, you see the most common is car, truck, or van. Walking or riding a bicycle seems to be less common. However, in Nassau and Duval, almost 2% walk to work. In Baker County, that's close to 0, which would back up the data on our bicycling fatality slides we examined earlier. Riding a bicycle to work is most common in Volusia County with 0.8% and less common in Clay and Baker County. Here we have the percentage of population living within a 10-minute walk, considered 0.5 miles within a park, so half a mile. In Northeast Florida, Duval County and Volusia County have the highest percentages, and Baker County has the lowest. And again, on the right side, you can see the state of Florida. The darker the color, it's the higher the percentage of counties who live within half a mile of a park. Okay, it looks like my internet connection may have a little temporary bleep, if you'll bear with me. Anyway, as I figure out this technical problem, walking or bicycling to a community park provides double the opportunity for physical activity, and on the way to the park and within it. Okay, if we can hold just a moment and be patient, I'm going to reconnect to the video conferencing. Okay, since I'm having a little bit of a technical problem, I'm going to go through the remainder of the presentation without the benefits of the slides, so bear with me. According to Smart Growth America, the city of Jacksonville has a walk score of 27, a transit score of 22, and a bike score of 40, all out of 100. This shows that Jacksonville is an auto-dependent city with limited public transit, bike, and pedestrian infrastructure. Sidewalks would improve the neighborhood's walkability score. Walkability, in turn, increases property value for both commercial and residential areas. And commercial properties with walk scores of at least 80 are valued at over 50% higher than those with walk scores of 20 or lower. Even an increase of 1 point in a property's walk score can raise its average price by 1%. Making sidewalks is a good economic investment and an investment into the health of individuals and the community. One of the slides was talking about the percentage of population that have access within half a mile of a healthy food source. This is, again, another health factor. Duval County has the highest percentage, and Baker County has the lower percentage. With healthy foods being within a half a mile of your home, that's a perfect opportunity for a bike ride to grab fresh and healthy food for your family, with the added benefit of exercise and reduced stress, as well as a reduction in air pollution. We also have information that the percentage of population living with a half a mile of a fast food restaurant, Duval County has the highest percentage. Again, Baker County has the lowest. Miami-Dade and Broward County have the highest percentage of individuals who live within half a mile of a fast food restaurant. We don't recommend utilizing a fast food restaurant, but if you're going to use one, please ride your bike. So in summary, public health and welfare has over time been removed from day-to-day operations and decisions of local government. So what I'd like to say to all of you who I appreciate taking part in this East Coast Greenway Summit is basically a call to action. When you are embarking upon initiatives such as the East Coast Greenway, during the planning progress, please consider the range of health issues like active living, environmental health, food nutrition, social cohesion, disaster planning, healthcare, communicable diseases, public safety, and mental health when determining the priorities. We would like the city and county governments to consult a public health representative on health-related issues like planning meetings or to sit on advisory boards and to review drafts of the comprehensive plan. So we recommend creating a task force for the purpose of developing the comprehensive plan. And with the task force, we believe public health representatives like folks from the Department of Health should be consulted by the city on health-related issues. And I think, engaging and embarking upon this process will help initiatives such as the East Coast Greenway to gain a lot more momentum by our cities and governments. And so I encourage you all to consider that as you move forward with your efforts. So in conclusion, you can see Florida is the top state when it comes to pedestrian and bicycle fatalities, a reason for many to avoid walking or riding their bike. The East Coast Greenway would be a great solution to make active transportation in our community safer, which will result in a healthier community overall. So today I'd like to say thank you for giving me the time to speak to you today. At some point, I'll try to get the slide back up and showing so that you can reach out to me if you have any questions or comments. My email address is Susan_Grich, that's G as in good, R-I-C-H, @ hpcnef.org. That's for Health Planning Council of Northeast Florida. And our phone number is 904-448-4300, and my extension is 112. Thank you very much.
Wow, thank you, Susan, for a very powerful and informative session. It certainly helped expand my knowledge and really showcase the importance of health planning. So, thank you again for that. As Susan mentioned, feel free to email her directly with questions. We also will have a hashtag for our virtual summit, hashtag Greenway Summit. If you want to tweet us with questions as well, we're happy to questions, comments, concerns related to any of our programming. Just feel free to drop us a line there. And we are very excited to have you join us, and feel free to tune in for some of our other sessions.